But the good part is we are back, and we're doing it in an educated and a smart way. We have started doing those procedures again. Our rehabilitation services are being offered. Our cardiac rehab is being offered to our patients. Now, on this week, we started allowing visitors to come to our facility, but we are limiting it to one visitor per patient. It is important that people understand we don't want you to stay at home and not get the great care that you deserve, because in doing so, you can find yourself in a more deconditioned situation and only coming when you are really, really bad, and that's not what we want. And that's why I'm so honored to be joined by such great physicians and nurses and others to help us better understand how we have worked together and we plan to provide the highest level of care in the safest environment possible. Now, what are some things that we're still not doing? Our volunteer services is still closed at this time. As you can imagine, that is a very vulnerable population. Many of our volunteers are seasoned, and we want to ensure that we are protecting them.
Our environmental service people put their lives at risk every day by going in to make sure that our facility is clean and as safe as possible. And that is not only true now, but it's been true in the past, but even more obvious to me at this time. We have enhanced some of their roles and made sure that they understand how important they are. And we continue to use a lot of the things that we've used all along. For example, we were the first in the state to have a special ultraviolet light that decontaminates surfaces and equipment very well. And we had instituted that several years ago. We've even beefed up how we are doing that with those machines. All the patients, when they arrive, and all the family members who may be admitted as visitors are screened, and we ask people to wait sometimes, particularly in the private offices, so that we don't have large crowds gathering within the institution at a time. We have asked that the patients wear masks, and we've in fact offered many of the patients some nicely homemade masks that people in the community have donated to us for patients who are staying in our hospital, such as up on the rehab unit in particular. We've asked people to limit the number of visitors, and in fact now allow only one visitor at a time, but at least we're back to allowing some visitors within the institution.
So what we're doing is we're screening everybody coming into the ER and masking them at the entrance. If we feel that there is any signs, symptoms, or concerns of COVID exposure, we are putting them into an isolation room separate from the other patients. We're treating them, testing them that way. But we don't want anybody to delay treatment for a sickness or illness because they fear that they might be exposed. You know, our numbers are down, and it's creating a better throughput for, you know, people that are really sick and injured. We also have, we have all of our providers and our nurses that are masking, and we have isolation rooms that we clean, and housekeeping has been doing a great job of getting those sanitized every time that we do have a positive patient. So we don't want, and what we've seen is the patients coming in are waiting longer to be seen because, you know, they could be having a heart attack or a stroke, and they're delaying their care because they're the fear of coming to the hospital, and we don't want that. So we are making sure that everybody is safely masked, and we're taking all the precautions we can.